Ladies and gentlemen, we will now bestow the highest honor of the American College of Radiology. We will now add additional names on our most distinguished roster, the recipients of the Gold Medal of the American College of Radiology. To this outstanding group, we add three of our best: Walter J. Curran, Jr., Lawrence P. Davis, and Charles D. Williams, all FACR. I am pleased to ask Dr. Walter J. Curran, Jr. to join me at the podium. Only through methodical and careful research can the science of radiology and radiation oncology continue to advance, bringing with it advances in patient outcomes. A longtime advocate and architect of ACR's research efforts, Dr. Walter J. Curran currently serves as a group and board chair for the NRG Oncology and National Clinical Trials Network supported by the National Cancer Institute. He previously held the role of group chair in the ACR Radiation Therapy Oncology Group, and he remains the RTOG Foundation's board chair. Dr. Curran graduated cum laude from Dartmouth College and received his medical degree from the Medical College of Georgia. After a residency in the Department of Radiation Therapy at the University of Pennsylvania, he completed an internship in internal medicine at Presbyterian University of Pennsylvania Medical Center in Philadelphia. Dr. Curran also went on to study radiation oncology at the University of Pennsylvania. In addition to his roles with ACR Research, Dr. Curran currently serves at Emory University as Executive Director of the Winship Cancer Institute and as Lawrence W. Davis Professor and Chair of the Department of Radiation Oncology. He is also a Georgia Research Alliance Eminent Scholar and the Chair of Cancer Research. He has also served as Chair of the Department of Radiation Oncology at the Jefferson Medical College at Thomas Jefferson University in Philadelphia. Dr. Curran specializes in the management of patients with locally advanced lung cancer and malignant brain tumors. In his search to understand these diseases, he has led several landmark clinical and translational trials. He has co-authored or authored more than 300 articles in peer-reviewed journals and presented papers and given named lectures at many venues throughout North America, Europe, Asia, and Australia. As a physician, Dr. Curran counts his greatest successes as the patients he's able to help through radiation oncology, whether that means a patient recovering from cancer or living longer or more comfortably than expected. Dr. Curran has kept patients in the forefront of his practice and in his thinking. And based on this remarkable career of both clinical and research contributions, it is my pleasure to award the American College of Radiology Gold Medal to Dr. Walter J. Curran, Jr.
So good evening and thank you. I really want to accept this extraordinary honor on behalf of hundreds and perhaps even thousands of physician investigators that have worked within the RTOG and now Energy Oncology over the past 50 years. True to the spirit of the American College of Radiology, those physicians, nurses, scientists, and other investigators have invested hundreds, if not thousands, of volunteer hours on behalf of their patients. Their core work is home at their own medical centers or their medical schools, but they come together in the evenings, on the weekends, to figure out the best way for us to advance the care of their patients and the patients around the world. And when you look at the extraordinary accomplishments of these groups, with a very modest federal budget, the progress we made against adult brain tumors, our understanding of patients with head and neck cancer and how we can treat them while preserving laryngeal and swallowing function, how stage 3 lung cancer went from an incurable disease to a disease that people are living with now for many years, how prostate cancer treatment is no longer something with significant toxicity, but is something men can live with in a healthy and active life. How new technologies developed by other colleagues in the American College of Radiology and beyond can be brought to the bedside, not to be implemented because there's now a payment code for it, but to be brought to the bedside and tested in a rigorous manner before we go forward. So for that, I accept this gold medal on behalf of those hundreds of people who have worked countless hours on behalf of their patients. I also accept this award on behalf of our own patients. This coming Wednesday, I'll see a woman in follow-up who was enrolled on an RTOG trial in 1998. I enrolled her on that trial while I was in Philadelphia. Circumstances allowed her to move to Georgia, so I now see her in follow-up. She is now 18 years following enrollment in a trial for a malignant brain tumor. At the time I treated her, she was a young nurse at a hospital in Philadelphia, unmarried. Now when I see her, we get the pleasurable opportunity to complain about the joys and sorrows of having adolescent children. She is without symptoms and living an active life in Norcross, Georgia. Those are the kind of successes that I accept this award on behalf of. And the trial that she was enrolled in back in 1998 was published just 2 weeks ago in the New England Journal, where for the first time, RTOG demonstrated or executed a trial, first trial ever in the world, to show a survival benefit for one therapy over another for this cohort of brain tumor patients. I accept the award also on behalf of FACR, because many of you in this audience don't realize what an amazing partner the American College of Radiology has been to prospective clinical cancer research literally over the past 50 years. When I started getting involved with RTOG, I did ask the question, how did ACR come to be the sponsor of this type of research? And what I learned was that John Curry, decades ago, worked with Simon Kramer in the radiation oncology department at Jefferson, and Jefferson Medical College found it a bit too cumbersome to hold a federal grant. So they suggested to John, why don't you bring it to the American College of Radiology? And the rest is history. I also want to talk about a term that I think is relevant to this setting today, and that's a term transdisciplinary. Many of us here studied rigorously for years in our discipline, which is, in this case, diagnostic radiology, radiation oncology, or one of our subspecialties. We know what interdisciplinary coordination is. We know what multidisciplinary care is. But the term transdisciplinary is a term I've come to know because I'm working in one of my responsibilities now, putting together a competitive renewal for our Cancer Center Support Grant at Emory. And one of the sections we have to write is, how does our Cancer Center promote transdisciplinary work? And by that they mean people taken out of their customary role and doing something different that will allow us to progress, in this case, against cancer. A radiologist having a new role in the organization to advance care, understanding, or benefiting patients in some way. And I would argue that anyone who's active in the American College of Radiology, be they board members, be they the new fellows, really function in a transdisciplinary way. The volunteer work all of you do on behalf of the college is not what you trained in fellowship in radiology for. The fundraising and the advocacy you do and the work you do on behalf of radiology around the world is not something you have a degree in. It's something that is a transdisciplinary effort. And I would argue for the next few decades, the work done by members of ACR to make progress against human disease, most of our efforts are going to be in transdisciplinary areas and areas that really advance science and our understanding of how to reduce suffering from human disease. And finally, I'd like to thank my wife, Laura, my family, my 4 children, my late parents, for all the efforts they've done. And I have one final comment for the fellows here, and that is, you should feel honored to get the fellowship here from the American College of Radiology, but the American College of Radiology should also feel honored by your participation with them. Thank you very much.
Shake your hand. Let's get a photo taken.